No? Ah. I'm just going to keep waiting until one person join. Once I have about one or two persons joining me, and then I'll start talking, please. All right, thank you for joining me back. Thank you for joining. I'm actually having problem with my phone. That's why it's giving me this kind of problem. Look at the phone I was using. The phone I was using to live stream. Look at the swollen. So it's iPhone 15. The battery is swollen. Look at how it broke the back of the phone. That's why I couldn't continue with that phone. I had to switch it to this other phone. The battery of the phone is actually a problem. The battery actually swelled up like this and broke the back. So thank you for joining me. As I said earlier, I am Nurse Linus. If you have questions regarding or concerning any health issues, please feel free to ask at the comment section. Please don't just watch. Like, subscribe, and share this link to your friends so that they can also join the channel. Please like the video, like as you join, just like, so that YouTube can recommend the channel to more persons to join. Please, as you join the channel, please press the like button. Press the like button as you join. Please tap the like button as you join. Tap the like button as you join so that more persons can join the channel, so that YouTube can recommend the channel to more persons. Please, I want to get like about 10 persons on the channel before we can start something. I'm going to explain what I'm studying now to you. It's basically about health. As I was trying to live stream in the other in the first video I started, I said that I'm actually studying and preparing for exam on midwifery. I'm preparing for midwifery exams. As you can see, look at this, the handouts. Let me show you the handout for the material for the study. This is the material for the study, as you can see. Midwifery. I'm preparing for this exam on Monday. It's fundamentals of midwifery. Fundamentals of midwifery. That's my name there, Nurse Linus. How many midwifery male midwives have you seen before? Do you know any male midwife? If you're joining, please tap the like button so that more persons can join. Tap the like button so that more persons can join. If you're joining me, tap the like button so that more persons can join the channel, please. So that YouTube can recommend the channel to more persons. I'm going to discuss something concerning I'm actually studying about nursing process. I'm studying about nursing process. Let me just take you to the video so that to the page so that you can see. This is what I'm studying tonight. I'm studying about nursing process. I'm going to write this in the exam. Have you seen the environment of the school? Let me take you through the environment of the school. I'm sitting at the first floor of the building, of the classrooms. I'm sitting at the first floor of the class building. At my right is the demonstration room where you have all the practical items, the models that we use in practicing, in learning before you go to the um, physical and practical that you use a patient, a live human being to learn. But at my right here, let me just show you. At my right here is the demonstration room where you have all the models, all the materials that are used for studying. We have the skeleton there. You have skeleton, you have models, every part of human body. There's a model of it that are inside that we use for studying. Let me just take you down there so that you can see. And I'm going to zoom it a little bit. As you can see, you have demonstration room too. This one is basically a demonstration room for medical students. And it's because today is Friday. I mean, because today is Saturday, um, that's why it's locked. So as students, we usually come out when we have exams like this. Even though we're not having exams, we usually come out to study in preparation for our exams. So if you have any question regarding health, please drop the comments below. Ask me anything on the comment section and I will respond to you. Do you have any health complication? Do you have any health challenges? Do you have anything regarding health? This channel is basically about health issues. As you know, that I'm a nurse and I deal with human health. I deal with diseases, prevention of diseases, promotion of health. My duty is to make sure that anyone who is sick, I'm able to provide advice on health. I'm able to provide health advice. I'm able to administer medications. I'm able to treat, and I'm able to give advice where necessary. As you know, health is an important aspect of our life. They said health is wealth. You must be healthy before you can do any other thing. You must be healthy for you to be able to go about your daily lives. You must be healthy for you to make money. You must be healthy for you to be able to meet up with life demands. If you're not healthy, life can never be sweet. That's why they say the first aspect of wealth in life is your health. Once you're healthy, you can chase money. Once you're healthy, you can pursue your goals. Once you're healthy, you can hustle. Once you're healthy, you can become anything you want to become in life. So health is the most important aspect of life. So stay healthy, live a good life, eat fruits, eat vegetables, avoid eating processed food because processed food leads to a lot of complications. Leads to diabetes, leads to um, a lot of things, cancer, things that are not supposed to be in your life, some health issues that you're not even supposed to develop. But because you're consuming some foods that are not healthy for your body, it leads to a whole lot of things. Avoid alcohol. Avoid consuming alcohol. Alcohol is a poison to the body. Alcohol is a poison to the body. Avoid consuming alcohol. Let me tell you a little story. We once had a patient, like I think the last 2 weeks, we were in the theater, and I think not really in the theater, in the labor ward. And you know, when a woman is about to deliver, there are some local anesthesia you have to give, not generalized anesthesia. The general anesthesia you give is the one that knock you off and put you to sleep before any other incision. That incision means cutting of your flesh, or cutting a particular part for a particular purpose before incision is being done. And then this woman was about to give birth, but the birth canal, I don't want to call the real name because of YouTube. The birth canal, the female birth canal was too tight for the baby to come out. So as a result, when such cases happen, they give episiotomy. Episiotomy is putting a scissors at the birth canal, cut a little bit of the birth canal, so that the fetal head, that is the head of the baby, it's called the fetal, a baby is called fetus, so that the fetal head can pass. So after giving episiotomy, the baby was delivered, and then after the delivery of the baby, that place that was cut needs to be sutured. That suture means sewing. That place needs to be sutured, and so before suturing that place that was cut, you need to give local anesthesia. Local anesthesia is the one you give at a particular place, just within where you want to suture, within where you want to, let me use the common language, sew. So after giving the local anesthesia, we were trying to suture, but the woman was still feeling pain. Normally, the anesthesia is supposed to numb that place so that the woman will not feel pain again. But yet, the woman was still feeling pain. And then, who can tell me the reason why? The reason is because once you consume alcohol, if you're the type of person that consumes alcohol, anesthetic drugs, anesthetic medications will not really have effects on you. Especially, example like lidocaine. When lidocaine is one of the anesthetic medication, when it is given to numb that area, the effects will be quite low. The effects will not be strong as expected. Okay. I'm just going to respond to some of the questions I've been asked. I think these few persons have gone offline. Sorry, I was still trying to explain something. That's why I could not respond. So I'm going to respond to some of the questions here. Okay, you're back. Century 06. You're back. Century 06, you asked about pneumonia. Pneumonia, how can you treat it? Pneumonia is actually a bacterial infection. It's actually a bacterial infection, but some persons believe that pneumonia is caused by cold. But pneumonia is not actually caused by cold. Pneumonia is a bacterial infection that can be gotten from within the environments or foods. So when you have pneumonia, the best way to treat it is, one of the ways to treat it, let me say, is to add some medications, but particularly using antibiotics. Antibiotics fights bacteria. Anti fights it, as in medications that are against bacteria. They fight and kill bacteria. So there are different types of pneumonia. So what I will advise is that you go to a diagnostic center or to the hospital, do some diagnosis so that they can identify the particular bacteria that is responsible for that pneumonia. So then the treatment can be given to you. avoid taking antibiotics by yourself, or doing self-medication, or going to the pharmacy and just asking them for drugs, or going to local pharmacy and requesting um, for drugs. Most times why we treat some illnesses or some disease and we don't get remedy for it is because majority of bacteria and majority of, let me say, virus, majorly bacteria in our body, they are of different types. Bacteria are of different types. So when you don't do diagnosis, let me say, is test, carrying out laboratory tests to know the particular bacteria and to identify the drugs that can respond to that bacteria, that can kill that bacteria in the body. You may be taking medications and the medications will not work. So don't just buy drugs. There's something they call targeted treatments. The targeted treatment is that the antibiotics you're taking goes direct to fight that bacteria. You know, bacteria, there are millions of bacteria. There are thousands of different classes of bacteria. So it is advisable that you you do a lab test, carry out lab test, and identify the particular bacteria in your body so that you can have a targeted treatment. Okay. Thank you, Century 06. Thank you, Century 06. I appreciate. Thank you. So, Century 06, please go get a lab test and identify, so that they can identify the particular bacteria that is responsible for the pneumonia, and then you have a well-targeted treatment. In that way, you will get well faster, and you will get well completely, because the bacteria will be completely eliminated from your body. Instead of doing half treatment, taking a particular antibiotics that will not give you complete effects. So thank you. Any other question, please ask your question. Let me see if I can get any other question. If you have any other question, please, concerning health, ask below. I'm here to answer you. I have a whole lot of books here that I'm studying. As I told you, I'm preparing for exam. I've studied throughout the day, so now I just want to talk to my subscribers. Any health-related issues, ask me. So as I was saying earlier, avoid processed food. Take natural fruits. Eat natural fruit. They are very essential for your body. You may not know. Some of us believe that it's food that is expensive food that are sold in the eateries, like ice cream, pizza, a burger, and many other processed foods that are good food. They're actually not good food. Processed food are not good for the body. Okay, Century 06. You said, I recently saw blood in my mucus. What is the cause? Okay, blood in the mucus can be caused by a whole variety of things. But the color of the blood determines what can be the real cause of it. So the color is very essential. The color of the blood you saw on your stool, is it a fresh blood, or is it dark red? Is it light red or dark red? You know what I mean by dark red? Like sometimes when you have injury and then you bleed, and after some time, if you fail to clean the blood from that site of injury immediately, you know how the color is. You know what I mean? You know how the color looks. So, okay, light red. Okay, light red. That's a fresh blood. It can happen because of few things. It can be because of constipation, like like this strong stool that you have to press of it to get it out of your body. You know what I mean? That comes as a result of constipation. That maybe you fail to go to toilet within 2 or 3 days, or sometimes, let me say, within 2 days. Normally, you're supposed to go to toilet, as elimination is part of life. What you eat, you must eliminate it. What you drink, you must eliminate it. So, um, it can happen as a result of constipation. It's all right. That can be as a result of constipation. As I said, a strong stool can cause maybe a little tear in your rectal part. I don't want to mention the words. That's why I'm using in your the rectal part, or rectum. Rectum is like the anus. Okay. So when you have a strong stool, when you're passing out strong stool, it can cause that. Another one is when you're having ulcer. Ulcer can also cause that. But in the case of ulcer, it is, I don't know if you have if you have ulcer. Century 06, do you have ulcer? Or were you having constipation? Ulcer can cause it, but in the case of ulcer, before the blood will travel from the stomach through the small intestine, through the large intestine, and before it now gets to the rectum, the color of the blood will change, because that's taking a little time. The time intervals cause the change of the color of the blood. That means it's not fresh. So that one comes as a result of ulcer. So okay, no, it's from my nose. Okay, from your nose. The blood that comes from your nose, it can come as a result of that one is called epistaxis. It's called epistaxis. Bleeding from the nose. Is it bleeding from the nose? Bleeding from the nose is epistaxis. Epistaxis. Yeah, you know the nose. Let me explain why sometimes we bleed through the nose. There's blood vessels that are connected to our nasal opening, especially this nose, that is this part that is responsible for smell. You have blood vessels. What I mean by blood vessels is either the vein, or the arteries, or capillaries, or venuses. So they are connected to the nose, and so they are very close to the nose, the part that is responsible for smell. So sometimes when the blood is light, or when the temperature of the body is light and the blood is very light, some of those blood escape through those blood vessels, those that are connected, that the openings are close to the nasal cavity. What I'm missing, the nasal cavity is the nose. Those openings are called sinuses. Those openings are called sinuses. Thank you very much. Century 06 said, I wish you success in your exam. Thank you so much. I'm fine, ma. Yes, I was there. Yes. So those sinuses are openings of, actually. So those blood sinuses, that are open through the nasal cavity. Sometimes when the blood is hot, it escapes through those blood vessels. When the blood is light, it escapes through those blood vessels. So what you need to do is, whenever such thing happen, what you need to do is to do like this. You press this place down and put your head up like this. As you press this place down, it blocks those openings, those sinuses. And then you put your head up for about 5 minutes. You sit up like this, hold it for about 5 minutes. After 5 minutes, you can remove your hand and wait for a little while, observe and see if it's not coming out again, and then it goes. It's a normal thing that it happens to a whole lot of persons. It has happened to me before, or also that happened to me once, but throughout my lifetime it has happened just once. And then if you're having either catarrh or you're coughing, and you know coughing or catarrh, most times coughing is as a result. It happens when it's frequent or when it's like over 2-3 days. It causes inflammation of the larynx. It causes inflammations of, let me use the common word, on your throat. It causes inflammation. Inflammation is like wound. That's the common word. It causes inflammation, like little wounds around there. So those wounds, as you cough, when you cough, you stress the muscles of the larynx. So as a result, it's the contraction causes the muscles to release blood. So that's why sometimes you see blood in your cough, or what we call it, blood in sputum. Catarrh is called sputum. That's the medical language for catarrh. So blood in sputum happen as a result of that. So thank you so much. Thank you, Century 06. Thank you for your question. I hope I've been able to give you helpful answers. Thank you, Century 06. You've always been here. You're one of my dedicated subscribers. You've been with me since. Thank you for joining. Thank you, Century 06. Thumbs up for you. 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 Thank you so much. Century 06. Two bosa for you. Bosa, bosa, bosa. Thank you, and I will make you proud in my exam. After the exam, I'll come and I'll personally go on live again and show you my results. But nursing exam, it's very stressful. Very stressful. You study a whole lot of things, broad studying, and at the end of the day, maybe you will never know where the question is coming out from. So right now I'm studying about 7 courses. Complicated midwifery, normal midwifery, infants, and pharmacology. Pharmacology is about drugs. Studying about drugs and knowing drugs that are helpful in labor, drugs that can reduce pain in labor. So we call it narcotic analgesic, that are used in relieving pain in labor. That's for pharmacology. Which other course again? I've mentioned infant, I've mentioned complicated midwifery, I've mentioned normal midwifery, fundamentals of midwifery also. I'm studying fundamentals of midwifery. That's the one I'm reading now. Then community midwifery also. I'm studying about community midwifery. And then there's other part that is called OSCE. That one is basically practicals. You study practicals, go to the hospital for clinical practice, go and witness a woman put into bed, and you see the physiology of it, as in how nature works perfectly with it. So um, I think other courses also. I'm trying to. All right. Thank you for joining me. Thank you for joining me. Let me go back to studies now. See you. Um, see you tomorrow. But I may go live if I'm awake throughout the night. I may still go live again. Thank you, Century 06. Next time when you join the channel, please bring your questions concerning your anything that is disturbing you, any health issues that is disturbing you. Please bring it. I'm here to offer the possible help I can in explaining it to you. Thank you so much. See you in my next video. Bye.